And since being in such a career, I have always been pro-science and pro-vaccination. Before my vaccination, I was a healthy and active 39-year-old. I enjoyed activities outside, traveling and crafting with my family. I also cherished my work in a very busy pediatric dental office. I was not taking any medications prior to the vaccine, and I have never had a COVID infection, and I have been tested for proof. In January, my life changed drastically. Immediately after the injection, I felt an odd tingling type dripping sensation in my arm. I had immediate heart palpitations and a feeling as if I was going to pass out. I'm so sorry. And my blood pressure reading was so high that I don't know how I didn't have a stroke. I cannot quote what it was, but as a hygienist, I take blood pressure readings on my patients before I treat them, my adult patients. And it was so high that I was scared in that moment that something was happening to me. I did eventually stabilize. They monitored me for the 15 minutes and then an extra 30 minutes after. And I did stabilize, so they went on ahead and sent me home. When I got home, I felt a little, woozy, a little dizzy. The next couple of days, I just had a headache and just kind of that feeling of unwell, all of the things that I had signed up for to get the vaccine. But it was 3 days later that my symptoms increased and accelerated. I had a sharp stabbing pain in my scapula area that was just this intermittent, like a knife stabbing pain. I had tingling and numbness throughout my body. It ran down both my arms. I also still had the heart palpitations. I had these internal vibrations. And the only way I can explain the internal vibrations is it feels like you have this little electric shock running through your body, like you're stuck in a vibrating chair, like glued into it, and it never stops. I have tremors in my hands, which has made me leery if I'll ever be able to practice as a hygienist again. And like Cheryl, I am so fearful that I may have some sort of neurological issue after this with Parkinson's. They have ruled out MS, but again, they have not told me that I have anything. They can tell me what I don't have. I have swollen lymph nodes, brain fog. I had brain fog so extreme that I would be having a conversation with someone and I would black out. Try to come back to that conversation and nothing was there. Swollen lymph nodes, muscle weakness, unexplained skin rashes. I had convulsions and nighttime seizures. I had to have my 6-year-old daughter wake me up from a fit in the middle of the night. No 6-year-old should have to do that for their parent. I have also experienced thick, clotting, heavy menstrual cycles. I was so afraid that I literally, and I have it with me, I prepared my will and my obituary for my family because I didn't think that I would wake up to the next day. I have reported my symptoms to VSafe, VAERS, CDC, FDA, Pfizer. I have also sent information to 2 very well-known research institutes, and I have also reached out to prestigious universities. I've been dealing with this for 5 months. These past 5 months, my severe neurological reactions continue to plague me. Every day feels like I'm trapped in the movie Groundhog Day. I go to sleep praying, thinking I'm going to wake up the next morning and be better. And I'm not. I've had multiple tests, more than any person should have to go through this time in their life. I have had x-rays, blood work, MRIs, CT scans, ultrasounds, EEGs, and more. To date, the medical community has still remained baffled and unable to restore my health. I'm scared and frightened for my future. So I do have hope, and this is why I'm here today, speaking out. This is not an easy thing to do, guys. But I hope that our conditions will be researched and studied. I hope that we can find a solution and a pathway to health. That's all we want. I would give anything. I would give my whole life savings if I could go back to January 17th and never to have had to experience this in my life. And 3, that those that are suffering and that those that will come behind us, because the vaccine is still rolling out, that they will benefit from us coming forward and speaking today. We have suffered long enough. I think that we do deserve this time that you've given us today, and we are so gracious that you've taken your time to be here today. But we do deserve to be seen, which you are seeing us today, and heard, you're listening, but we need to be believed. That is the biggest issue. We just want you guys to believe that this is real. We are real Americans. We are real people experiencing these side effects. So I thank you for doing just that today.
Real close, Stephanie. So we can hear you.
All right. So first, thank you, Senator Johnson, for the opportunity to share Maddie's story, and to all of you for your willingness to listen. This isn't easy for me, and this has been very clearly emotional. So I'm going to read what I've written so I don't lose track. My name is Stephanie, and this is my daughter, Maddie, and we live in Ohio. On January 20th, Maddie received her second dose of the Pfizer COVID vaccine as a participant in the clinical trial for 12 to 15-year-olds. All 3 of our kids volunteered and were excited to participate in the trial as a way to help us all return to normal life. My husband works in the medical field, and I have a degree in electrical engineering. We are pro-vaccine and pro-science, which is why we agreed to let Maddie and her 2 older brothers volunteer for the trial. Before Maddie got her final dose of the vaccine, she was a healthy 12-year-old who got straight A's and had lots of friends. She had a life. She was energetic. She was not like this. Although she does still have lots of friends. Upon receiving the second shot, Maddie immediately felt pain at the injection site. And over the next 24 hours, she developed severe abdominal and chest pain. And the way she described the chest pain, and I quote, "It feels like my heart is being ripped out through my neck." She had painful electrical shocks down her neck and spine that forced her to walk hunched over. She had extreme pain in her fingers and toes. It actually made them turn white, and they were cold whenever you touched them. She had edema. So my husband immediately took her to the ER as instructed by the vaccine trial nurse administrator, which is what we were instructed to do. Her blood was taken for a renal profile and tested. She was checked for appendicitis, which she did not have, and given an IV with some medicine, then sent home. However, in the discharge papers from the Children's Hospital ER that she went to, the diagnosis stated adverse effect of vaccine initial encounter. This would be the only time that that was written in her medical charts, but it's in there. Over the next 2.5 months, her abdominal, muscle, and nerve pain became unbearable. She had developed additional symptoms that included gastroparesis, nausea and vomiting, erratic blood pressure and heart rate, memory loss. She mixes up words, brain fog, headaches, dizziness, fainting. She fell and hit her head, and then seizures. She developed verbal and motor tics. She had loss of feeling from the waist down and muscle weakness. Drastic changes in her vision, urinary retention and loss of bladder control, severely irregular and heavy menstrual cycles, and eventually she had to have an NG tube put in to get nutrition. All of these symptoms are still here today. Some days are worse than others. Our greatest challenge came when her doctors began to consider an alternative diagnosis. Well, she really didn't have one before, so it was the first one. So, like everybody else, she had lots of tests, but not nearly as many tests as everybody else, and she's a child. Why didn't they do this? All those tests on her. Sorry. So, because they couldn't figure it out, One physician labeled her as having functional neurologic disorder, saying it was due to anxiety. This concerned us, and we didn't agree with it because she doesn't have anxiety. Look at her. I mean, what 13-year-old can sit here calmly, okay, if they have anxiety or mental issues? At one point, they even tried to admit her to a mental hospital. So we did seek additional medical opinions, some of which came from this group. In June, we connected her neurologist with another doctor that's doing research on adverse reactions like Maddie's. She was finally provided, but they finally gave her an MRI, did an MRI of her brain, an MRV, and a bunch of additional blood tests. It took 5 months to get that done. Over the past 5 months, Maddie has been to the ER 9 times and has been hospitalized 3 times for a total of 2 months in the hospital. What I want to ask, Maddie volunteered for the Pfizer trial. Why? Why aren't they researching her to figure out why this happened? So other people don't have to go through this. Instead, they're just saying it's mental. If anybody's mental, it's me. So today our journey as parents to help our daughter Maddie continues. All we want is for Maddie to be seen, heard, and believed, because she has not been. And we want her to get the care she desperately needs so that she can go back to normal. Why is she not back to normal? She was totally fine before this. She did the right thing trying to help everybody else, and they're not helping her. Thanks.